I'm Howard Routman. I'm an orthopedic surgeon. My specialty is shoulder reconstruction. I've been with Atlantis Orthopaedics for 23 years, and my practice is really just shoulders. I take care of every type of shoulder problem that there is, from instability to fractures to rotator cuff problems and also arthritis. A lot of the stuff that I do is redo shoulder surgery. I think that around a third of the people that come to see me have already had surgery done someplace else, and they're coming for an opinion as to what can be done to improve things. I see patients in Lake Worth and Palm Beach Gardens every week, and I operate both at the hospital and at surgery center depending on the severity or complexity of the surgery and the health of the individual having an operation. I grew up in a household where my mother was an art teacher, and my father started off selling shoes and went to law school at night after he finished selling shoes during the day. And my father was the first person in his family to go to college. As the firstborn kid, I went to public school in the state of Florida and got into the University of Florida. And when I went to UF, I had a pretty good time, and then learned pretty quickly that I was drawn more towards the sciences. Had a hands-on class doing some anatomic stuff, and it sort of really lit me up. I knew that was something I wanted to get involved in. I ended up going back into South Florida to Nova-Southeastern to go to medical school, and immediately knew that surgery was the direction in which I wanted to go. After a few different experiences in other areas of surgery, I knew it was orthopedics or bust. It was really the only thing that really excited me to wake up in the morning to do, and I'm glad I did it. I did my orthopedic training in Philadelphia, and that's where both of my daughters were born. And when I was doing my orthopedic training, the one area that I felt I wanted to learn more about was shoulder reconstruction, because there just wasn't a lot of it going on. It was a relatively young field. I mean, hip and knee reconstruction had been going on for a while. People were doing spine surgeries and hand surgeries, but there really just wasn't a lot out there on shoulders at the time. Just to put this into perspective, arthroscopic shoulder surgery was being born at the time that I was training. Okay, the idea of putting a camera inside the shoulder to do something was still considered a little bit crazy. They thought the people doing that were sort of cowboys. And so I grew up orthopedically during a time that was pretty cool to be learning shoulder stuff. So my classic training was in doing open shoulder surgery, opening up the shoulder to fix things. But during my career, I've been able to make my way all the way to the minimally invasive, tiny little portal keyhole incision surgery, where we can do big reconstructions through tiny little incisions. In addition to that, my research when I was a fellow doing my shoulder fellowship was on this really strange combination of arthritis of the shoulder with rotator cuff problems, which was at the time considered to be a very small percentage of the population. Now we realize it's a much bigger part of the population, and reverse shoulder replacement ended up being something that I happened to be launching my career just in time for that to be a major operation that has changed shoulder surgery all over the world. One of the things that ended up happening was, because I was doing complex shoulder surgery in 2002, 2003, I ended up getting involved in the investigation of reverse shoulder replacements in the US prior to their FDA approval. So the first reverse shoulder replacement that was done in South Florida, I did as part of an FDA investigation in 2002. So it's been a really interesting journey, because shoulder surgery as it is now is very different than it was when I was training. And it's been a really exciting time to be doing shoulder surgery. It's a very fulfilling job. So I love what I do. When patients come to see a shoulder specialist about problems that they're having, they come for many different reasons. Some people are coming just because they're having a hard time sleeping. Other times people can't even dress themselves without significant pain. Understanding what the individual goals of the patients are and the impact that the problem that they're having is having on them is really the first step. Because in the end, our goal is just to get to the point where someone comes back and says, I'm good. And if you can get the patient to the point where they say they're happy, doesn't really matter to me how we get there. If it's a matter of education, activity modification, physical therapy, injections, or surgery, as long as we get to the end, to the finish line, which is different for each individual, then we're satisfying the people that we're taking care of. So my approach is very customized based on the needs and the desires of the individuals that I'm looking after. I take care of high school kids that dislocate their shoulder playing football and they want to get back to play the next season. And I take care of 82-year-old grandmas, great grandmas, who are having a hard time dressing themselves because they can't get their arm away from their body. Totally different sets of expectations, totally different sets of what they would identify individually as being, this is a success. So I guess the critical thing is understanding on the front end, what does the patient identify as a successful outcome? And then working with them with a customized plan of care to be able to achieve that. And that's why it takes some time to sort of get to know your patient and to sort of figure out what it is, like what's driving them to come to see you in the first place. Probably the most common thing that people come to me for are rotator cuff conditions. It can be something where the rotator cuff, which is a small group of muscles around the shoulder, are inflamed and causing minimal functional impact, and can be managed very easily with medications, physical therapy, or whatnot. Or sometimes folks come in after a fall where they've torn their rotator cuff and now they can't lift their arm. They're on an airplane, they take down a piece of luggage overhead that they think weighs 10 pounds and it ends up weighing 40. And then they can't lift their arm up after that injury. That's something that we typically fix with an arthroscopic rotator cuff repair. So rotator cuff problems are probably the most common thing that I see. Also, a really big part of my practice is managing shoulder degenerative conditions. Arthritis of the shoulder, particularly arthritis of the shoulder when it's coupled with degeneration of the rest of the shoulder. So it used to be thought that arthritis of the shoulder typically happened with the rotator cuff being intact and spared. But we're seeing more and more now that patients have a combination diagnosis where it's not just a rotator cuff issue and it's not just arthritis. It's a combination of the two together, and that can be treated really reliably with surgical treatment. So the two most common things that I see are rotator cuff tears and arthritis of the shoulder. In addition to that, there's a sprinkling of trauma, broken bones in the shoulder, broken collarbones and things like that. And then shoulder instability, people that have a shoulder that dislocates and keeps on dislocating and require some type of treatment in order to get their shoulder to stop dislocating so they can live their life. If I was going to say that's the edges of my practice, that's the main stuff that I take care of. I've been involved in the design of a shoulder replacement implant, and the implant that I've helped design has been approved by the FDA in the US, but it's also been approved by the European Union and a number of other international bodies. So I end up doing quite a bit of international travel and teaching. So I'm going to Italy on Friday, and 2 weeks later I'm speaking in Dubai, and I've done shoulder surgery in Brazil, Australia, all throughout Europe. So I have a lot of frequent flyer miles, and I get to go and talk about something that I'm clearly passionate about. I enjoy having conversations with people who are interested in learning the stuff that we've studied. We've published a number of papers on this, and it's great to be asked to be a part of the educators that are teaching other surgeons the things that we've learned. And now that I'm in the, just passing the halfway point in a career, I'm 23 years into this. It's cool now that I'm the person that's speaking down from the podium instead of sitting in these meetings and looking up the podium and trying to learn. Despite that, I learn more from each one of these meetings that I go to than I teach, because I get to be around some really smart folks, and we share ideas, share concepts, and I get to come home smarter than I left each time. When I'm not doing that, I'm a pretty avid and not great golfer. I enjoy playing, and always trying to work on my game and get better. And I'm trying to figure out how to catch fish. And I haven't quite figured out how to do that properly. I know how to look for them. I just don't know how to catch them very well yet. That's a goal for the next 10 years, I hope. Everyone has a story, and everyone really has a very specific thing that is important to them. And I think that it's important to come prepared to, as best as you can, clearly articulate what you want out of the care that we're going to try to provide. I think it's always helpful, if you can, to have someone come with you when you come in to see a surgeon, because we give so much information in a short visit that numerous studies have shown that if a patient retains 30% of what you talk to them about, they're really listening and paying attention. Sometimes folks will come into the office and with their phones are like, can I record this conversation? And I think that's great because it allows them to go back and listen to the conversation and really relive it and understand that. I think that it's always good to be able to remember as much as you can, because if you're coming to get someone's opinion, you want to be able to remember it. I typically will reach out to my patients when we're talking about surgical intervention and provide them my email address. So if they need to be in contact with me, if they leave and they have questions, they're able to reach out to me directly. And we have a decent amount of information available online for our patients to look at, specifically related to the surgeries that I do and the most common questions that patients might have, and the instructions for post-op care, so that there isn't any daylight between what I think should be done and what the patients think I think should be done. So we have a very good way, hopefully, of communicating with each individual in that regard.